When I was 10, I started spending a lot of time with my dad in his pharmacy on the south side of Chicago. And he worked long hours. And part of what I learned was just this incredible community he worked with in his own pharmacy. And I remember one particular time that we left the pharmacy, at 5:30 and went and drove to one part of the south side of Chicago, driving through what seemed like communities that were not invested in and down and out. And I think it left a mark on me about like the struggles that people in underserved communities or with struggles that happen every day. And I think that was an inspiration for me, but also helped me see the communities people try to achieve health in. And I think those early experiences with my dad helped me see how a broader view of health. I thought I wanted to be a doctor fairly early on through my life in high school. As I spent time through college, came upon this when I went to go get a haircut at a barbershop and started talking to black men there who were struggling with their own health care and being able to access it in a way that was respectful. So that was a shift in how I saw myself in medicine. I wanted to doctor in underserved communities as a vehicle for social change and partner with communities to change their future because I saw it happen there. And now what led me to Deloitte was really an experience in 2017 when I was at the American Hospital Association. I interacted with some of the leaders of the future of health who had worked on a new vision of what health would look like in 2040. And we started talking about that, and there seemed a lot of similarities around where we were trying to move hospitals and health systems and where Deloitte was trying to move the market. And that stuck with me. I had made the transition to community, which I still see patients every week in a community health center, and I love doing that. But Deloitte was an opportunity to drive impact at scale, and the commitment that Deloitte has made to health equity is significant, and that was compelling. The clinical environment gives us an opportunity to learn and ask what the community needs rather than assuming what they need and what might work for them. And I think that that's really important, the voice of lived experience in shaping our research and eminence work. I think mental health is extremely important. For me, what I realized and learned was asking for help was important, and particularly around depression. And as physicians, we're not taught to ask for help. We're taught to just do things ourselves and get things done. And so it was a place where I learned how to ask for help. And I took, I got involved in therapy. I, talked to my program, talked to others around me, my community, strengthened the community that I had to support me. And the other thing is I had forgotten how to dance. I had forgotten that that was an important part of my life and I could bring it to my practice as a physician. When I was in Boston training in my internal medicine residency, I took care of a Brazilian man who was in his 60s who was struggling with kidney disease. And so I felt like I needed to lift his spirits. I needed to do something different. And so I put my iPhone next to his ear and I played a Bollywood song and I started dancing at the bedside. And you could see his smile grow and grow and his sort of spirit raised. That stuck with me as something that I felt like I needed and wanted to do in my work as a doctor. So it's something that I think I saw as not just the physical activity part, but creating community and connection. And I started dancing before I gave speeches. I danced in front of med school deans, and I've danced in front of healthcare executives. It's the best way I know how to show gratitude and say thank you and share, a part of me that's really important with them. But it also humanizes, I think, our interaction and experience.